feel like I have like an elephant sitting on my chest.
Meet Hal. He's not your average mannequin.
Let me take a listen. I'm just going to touch, okay?
Hal is what you call a high-fidelity simulation mannequin.
Yeah, I know, I'm really still having trouble breathing.
As these students work together to understand and manage Hal's condition, his symptoms and responses are happening in real time, just out of sight.
I'm really starting to feel kind of wheezy. We can make him, breathe and have different sounding. We can make him sound like he's having an asthma attack. We can make him have a seizure.
Hal can simulate strokes or heart attacks. He can sweat, cry, and run a fever. He can even turn blue from a lack of oxygen. All at the hands of Heather Monroe, a nurse of 38 years and interim director of simulation here at Mass Bay Community College in Framingham. Seated just beyond this glass window, Heather follows a pre-planned template of a medical scenario for Hal, with a specific theme for students to respond to.
I'll sort of let the simulation kind of just go and progress. If I want a certain goal achieved, and maybe the students aren't getting there on a timely fashion, they might need a little bit of a cueing.
I think the nurse last night said if I needed it, maybe they could give me something to help me breathe.
We just did a simulation, and we were just talking about it. It was amazing of how realistic it was. You were really put in a situation where you have to think and act quick, and I mean, it's like top-notch stuff. Like, everything looks real, the mannequins look real, and that kind of really helps you to better prepare yourself.
Natalie's in the second semester of her first year here in Mass Bay's Associate Degree Nursing Program.
What do we want to know about this patient?
Does he have any history of respiratory COPD?
We want students to, when they get to the clinical settings, be at least competent in what they're doing. So that's why they can come to simulation, which is a safe space. It's a physically safe space, it's a psychological safe space, and I tell students all the time, come here, make mistakes, then we'll learn from them so that when you can go to the clinical unit, you sort of have a little bit better appreciation and feel a little bit more relaxed in what you're doing.
Within Mass Bay's Simulation Center, these mannequins are just one piece of the puzzle.
You assess for a facial droop, you have them smile, okay? And you can kind of see one side facial droop.
This is Mass Bay's immersion room. Today we're in the back of an ambulance transporting a patient who's having a stroke, going over important procedures along the way.
But if you're having bleeding onto the brain, do you really want to give a blood thinner? No, because that's going to make you bleed even more, okay?
Preparations are still underway to get this room geared up to its full potential for student learning. Without these state-of-the-art projectors and other gear, this room would look like, well, any other. But there's no limit to the environments this technology can simulate.
Say you're an EMS person responding to, an accident at the highway. We can make it look like a highway kind of pile-up car crash. Not only will you visually be cued that there's an accident scene, there's scent diffusers that come from the ceiling, and you buy different scents. So we can make maybe the smell of like burning rubber, smoke.
The idea here is that the more exposure students have to these simulated sights, smells, and experiences, the more likely they are to maintain focus and comfortability when faced with the real thing.
There's a lot of clinical reasoning and critical thinking skills. This is an applied science. It's one thing to kind of memorize what normal vital signs are, but then what do you do with that information? How do you apply it to your patient? And then what do you do if your patient doesn't have normal vital signs? And then how do you kind of take that from there and go forth?
Should be breathing better shortly.
I can't even count how many mistakes I made both in clinical and labs. We had a great instructor to help us, to guided us, and I think better preparing us. And I think this is the place where, yes, like make the mistakes you need to so that in the real world you got it all down.
Does he have an IV?
Yep.
All right, do we know if that IV is patent?
The medication is called Lasix. It's a diuretic. So when we give it to you, we're going to give it to you in your IV you already have, and it's just going to help get rid of some of the fluid you have in your lungs and a little bit of the edema you have going on, the swelling, okay?
At a time when the healthcare field continues to face a shortage of workers, These students are eager to bring their skills and knowledge to a workforce dedicated to caring for others.
I realized that my calling was really just helping people, trying to make a difference. I know that sounds, that's what everyone says, but that's what really called me to be a nurse.
A little bit better.
Okay, that's good. Let's see if the oxygen is up to now.
So Lasix.